Hello everyone, and welcome back to our channel. Today, we're going to dive into a topic that affects millions of people worldwide every year: food poisoning. Whether you're cooking at home or dining out, it's crucial to understand the causes, symptoms, and most importantly, how to prevent it. So, let's get started. What is food poisoning? Food poisoning, also known as foodborne illness, refers to a condition caused by consuming contaminated food or beverages. Contaminants responsible for food poisoning can include bacteria, viruses, parasites, or toxins produced by bacteria or molds. What are the causes of food poisoning? Bacteria. Bacteria are one of the most common causes of food poisoning. Examples of bacteria that can contaminate food and cause illness include Salmonella, Escherichia coli, E. coli, Campylobacter, Listeria, and Clostridium perfringens. These bacteria can multiply rapidly in food if it is not stored, handled, or cooked properly. Viruses. Viruses such as norovirus, hepatitis A, and rotavirus can contaminate food and cause food poisoning. These viruses are highly contagious and can spread easily through contaminated food, water, or surfaces. Parasites. Parasites like Giardia, Cryptosporidium, and Toxoplasma can contaminate food and water sources, leading to foodborne illness. These parasites can cause severe gastrointestinal symptoms when ingested. Toxins. Some bacteria produce toxins that can contaminate food and cause illness. Examples include Staphylococcus aureus, which produces toxins that cause symptoms such as vomiting and diarrhea, and Clostridium botulinum, which produces botulinum toxin, causing botulism. Chemicals. Chemical contaminants such as pesticides, heavy metals, e.g., lead, mercury, and cleaning agents can contaminate food and cause food poisoning if ingested in sufficient quantities. Allergens. For individuals with food allergies, consuming foods containing allergens such as peanuts, tree nuts, shellfish, eggs, milk, soy, wheat, or fish can cause allergic reactions ranging from mild symptoms to severe anaphylaxis. What are the symptoms of food poisoning? Nausea. Feeling of discomfort or unease in the stomach, often accompanied by a sensation of needing to vomit. Vomiting. The forceful expulsion of stomach contents through the mouth, which can occur as the body's natural response to eliminate the harmful substance. Diarrhea. Frequent, loose, or watery bowel movements, often accompanied by abdominal cramps and urgency to use the bathroom. Abdominal pain or cramps. Discomfort or sharp pains in the abdomen, which may range from mild to severe and can be localized or diffuse. Fever. Elevated body temperature, which may indicate an immune response to the infection caused by the contaminated food. Headache. Aching or throbbing sensation in the head, which may accompany other symptoms of food poisoning. Muscle aches. Soreness or discomfort in the muscles, which may occur as a result of dehydration or the body's response to infection. Fatigue. Feeling of tiredness or weakness, which may result from dehydration, loss of nutrients, or the body's efforts to fight off the infection. How to diagnose food poisoning? Medical history. The healthcare provider will begin by asking the affected individual about their symptoms, including when they started, what foods they have consumed recently, and any recent travel or exposure to potential sources of contamination. Physical examination. The healthcare provider may conduct a physical examination to assess the individual's vital signs, such as temperature, blood pressure, and heart rate, and to look for signs of dehydration, abdominal tenderness, or other physical indicators of illness. Laboratory tests. In some cases, the healthcare provider may recommend laboratory tests to confirm the diagnosis of food poisoning and identify the specific causative agent. Common tests may include stool culture. A sample of stool is collected and tested in a laboratory to detect the presence of bacteria, viruses, or parasites that may be causing the illness. Blood tests. Blood samples may be analyzed to check for signs of infection, such as elevated white blood cell count or antibodies against specific pathogens. Pathogen-specific tests. Depending on the suspected cause of food poisoning, additional tests may be performed to detect specific pathogens, such as polymerase chain reaction, PCR, tests for bacterial or viral DNA, RNA. Imaging tests. In severe cases or if complications are suspected, imaging tests such as abdominal X-rays or ultrasound may be performed to assess the extent of inflammation or damage to the gastrointestinal tract. What is the treatment for food poisoning? Fluid replacement. Dehydration is a common complication of food poisoning due to vomiting and diarrhea. Replacing lost fluids and electrolytes is crucial to prevent dehydration. Drinking clear fluids such as water, electrolyte solutions, e.g., oral rehydration solutions, broth, or diluted fruit juices can help maintain hydration. In severe cases, intravenous fluids may be administered in a hospital setting. Rest. Resting and allowing the body to recover is important during a bout of food poisoning. Antiemetics. Medications to reduce nausea and vomiting, antiemetics, may be prescribed or recommended to help relieve symptoms and prevent dehydration. Antidiarrheal agents. In some cases, medications such as loperamide, Imodium, or bismuth subsalicylate, Pepto-Bismol, may be used to alleviate diarrhea. However, these medications should be used with caution and under the guidance of a healthcare provider, as they may prolong the duration of illness or worsen certain types of food poisoning. Antibiotics. Antibiotics may be prescribed for certain bacterial infections causing food poisoning, such as Salmonella, Campylobacter, or Shigella. However, antibiotics are not routinely recommended for all cases of food poisoning and should be prescribed based on the specific pathogen identified and the severity of symptoms. Dietary modifications. During recovery from food poisoning, it's important to avoid foods and beverages that may aggravate gastrointestinal symptoms, such as spicy, fatty, or dairy-rich foods. Stick to bland, easily digestible foods such as crackers, rice, bananas, toast, boiled potatoes, and clear soups until symptoms improve. How to prevent food poisoning? Wash hands. Wash hands thoroughly with soap and warm water before and after handling food, especially raw meat, poultry, seafood, eggs, and produce. Proper hand washing helps prevent the spread of bacteria and viruses from hands to food. Clean surfaces. Clean and sanitize kitchen surfaces, cutting boards, utensils, and countertops regularly to prevent cross-contamination. Separate raw and cooked foods. Keep raw meat, poultry, seafood, and eggs separate from ready-to-eat foods such as fruits, vegetables, and cooked foods to prevent cross-contamination. Use separate cutting boards and utensils for raw and cooked foods. Cook food thoroughly. Cook foods to their recommended safe internal temperatures to kill harmful bacteria. Use a food thermometer to ensure proper cooking temperatures. Chill perishable foods promptly. Refrigerate perishable foods, such as meat, poultry, seafood, eggs, dairy products, and leftovers, within 2 hours of cooking or purchasing. Keep the refrigerator temperature at 40 degrees Fahrenheit, 4 degrees Celsius, or below, and the freezer at 0 degrees Fahrenheit, 18 degrees Celsius, or below. Thaw foods safely. Thaw frozen foods safely in the refrigerator, cold water, or microwave oven. Practice safe food handling. Avoid cross-contamination by using separate cutting boards, utensils, and plates for raw and cooked foods. Wash fruits and vegetables thoroughly under running water before eating or cooking. Be cautious with leftovers. Refrigerate leftovers promptly and consume them within a few days. Be mindful of high-risk foods. Be cautious when consuming high-risk foods such as raw or undercooked meat, poultry, seafood, unpasteurized dairy products, raw sprouts, and pre-cut fruits and vegetables. Pay attention to food recalls. Stay informed about food recalls and avoid consuming products that have been recalled due to contamination or food safety concerns. Conclusion. Practicing good food safety habits is essential to reduce the risk of food poisoning and promote overall health and well-being. That's all for today's video on food poisoning. Thanks for watching. Stay healthy. Stay curious.